All right, let's break down and decode some of the latest news from the CDC, the FDA, and COVID-19 task force. It's a lot to break down. Joining me to do that, we got expert Dr. Sujan Gogu. He's an expert in many aspects of medicine, among them family medicine. He's also a member of the Founders Circle of Doctors and Politics. You got a lot under your belt, Dr. Gogu, but it's a pleasure to have you, sir. So, the CDC's Omicron numbers for the week ending Christmas were well underestimated, right? In a big way. It went from 73% to 23% of all infections. Does this give fuel to the doubters, deniers, and conspiracists out there that we don't know what we're talking about, or better yet, health officials don't know what they're doing?
Yeah, so, I think when all you simply have to do is really look at the hospitals, look at the clinics, and just see how many people are just trying to seek care for symptoms that they're experiencing, whether it's headaches, body aches, fatigue, having a runny nose, coughing, and so forth. And I think if you just simply look at the hospitalizations, you look at the clinics and how busy they are, I don't think it gives credence to those numbers. I think there's a lot of sick Americans right now.
All right, well, speaking of a lot of sick Americans, right? How are health professionals like yourself reacting to this news that they were well undercounted the number of Omicron cases? How's that even possible?
Well, I think a couple of things. I think one, are we reporting all these tests accurately to the CDC? And you also got to keep in mind we have a lot of home tests right now, and a lot of those home tests are not being reported at all. But I think when you look at just the communities that we live in and how many people are just trying to seek to get a test, there's a lot of people that are sick, whether it's Omicron, and keep in mind we still have Delta that is out there, and Delta is a big force in getting people to be very sick as well.
Dr.
And so
Gogu, I'm sorry,
I think,
I want to
yeah.
ask you a question. You mentioned the home test, right? I mean, home tests are not going to be able to detect which variant you have. They're just going to tell you if you're positive or negative, right? It's the sequencing. And I'm not trying to take your job, but that's not something someone at home can determine. So, I mean, we're talking about health professionals here,
Right.
experts.
So whenever you do get a rapid antigen test, you don't know. You don't know whether you have Omicron or you don't know whether you have Delta. The only way you can know whether you have Omicron or whether you have Delta is if you do a PCR test, and if that PCR will differentiate both of those. And some PCR does not do that. So absolutely.
All right. So this question is for my producer and all the other hypochondriacs out there, right? How can one tell the difference? Because I mean, everything. I was told by a doctor there are over 200 different viruses circulating right now. So how do we know between Omicron, the flu, the cold? It's like everyone's pointing fingers at each other right now.
I worked in the emergency room on Christmas Eve and Christmas. And the one thing that I was noticing, particularly among Omicron patients that I did see, is a lot of times those patients would have a headache. A lot of times those patients would have fatigue, really bad fatigue. And a lot of them would have rhinorrhea as well. And those symptoms, when you look at the flu can present with a headache, the flu can present with fatigue. But a lot of times, with the flu, you have a runny nose that's very prominent. You have a fever that's very high. So there are some subtle differences, but a lot of these symptoms are very similar. And so even as a physician myself, I have to assume it could be COVID, it could be flu, it could be rhinovirus, it could be enterovirus, it could be a multitude of other viruses. So it is a very challenging task, but there are some subtle differences that you can see as a clinician, but you shouldn't assume that as a patient.
So if you feel anything, you should just automatically assume the worst, right? Because I feel like that's where a lot of folks are going. My producer, myself, I mean, just the tickle of something in your throat. Someone coughed while I was having breakfast, and I'm like, she's got COVID. So we should just assume before and then get tested.
So just through my experiences of really, being in the emergency room and talking to patients, the one thing that I noted is if patients were around people that were positive for COVID, you should really just assume that you possibly have COVID. If you have symptoms that are suggestive of COVID, you probably do have COVID, and you should really just start the quarantine rules right then and there if you can't get access to a test,
But
which a lot of Americans right now are having a hard time.
what are those symptoms though, Dr. Gogu? Like for folks at home, like are you saying there's no way to differentiate between a cold, the flu, COVID?
So there's a lot of symptoms that overlap, and I think that's what's challenging. But some of the symptoms that you do see, with COVID, obviously is headache. You have loss of taste or smell, which is really kind of less common that I've seen with Omicron, but could be there. You have rhinorrhea, which means a runny nose. You have cough. You have fatigue, which is really very well prominent. You have fevers that are very cyclic. I saw kids that were having fevers that go up and down very rapidly, and they tested positive for COVID. And some of those symptoms you don't necessarily see with the flu, but you can see with the flu. So that's what makes this really challenging during this time.
Totally. It's like you don't know what you got and what the person next to you has, which is why I guess it's important to just mask up, right? Vaxxed up. Speaking of that, in a briefing today, the COVID-19 response team, Dr. Anthony Fauci, again emphasized the importance of being vaxxed and boosted. Dr. Gogu, is that really our only defense out of this pandemic? Is that really going to work?
Well, I think it's a big, yeah, I think it's a big solution. Is really we still have only about 60 to 70% of people that have really gotten 2 doses, and if you look at America, we only have, looking at the recent data, only 20%, I believe, have been boosted. And you look at other countries like the United Kingdom, Israel, they have 50% of their population boosted. But I do think we have 2 tools that are coming soon, which include Paxlovid, which is a pill that we're going to be able to give to people that have comorbidities that could make them at risk for severe illness. That's going to be a tool we have. We also have monoclonal antibody, sotrovimab, which will be an IV infusion that we could also give to people that have Omicron, particularly in infusion centers or at the ER. So we do have some tools. Right now, we just have a shortage of these tools. And so once we get that, I think we'll be able to better treat patients than we are able to now.
Dr. Gogu, I mean, come on now. You said you just said it. You said there's a shortage. So how's that help folks now? I mean, cases are surging now, not tomorrow.
Well, I think we've been behind on this pandemic and really trying to address it at times, and I think I wish we could possibly even invoke the Defense Production Act really to look into getting some of these tools for us, because we really need more tests. We really need more of these therapeutics that could really help our population. And I think doing something like that, making it readily accessible to the people, to the counties, to the state and local health authorities would really be helpful. But unfortunately, we don't have those tools.
Yeah. So what do you grade the White House right now? What do you give them on a grade? You're the professor.
Well, I think there's a very well, I think they have a very difficult job. I think they've been doing a really good job with the messaging. But I think trying to get some of these resources, and some of which to be honest, Paxlovid just got approved through the FDA. And so some of these tools are just coming about, but I think that's a difficult task to be doing. But I think they could be doing a little bit more.
Okay, so since you didn't give them a grade, I'm going to assume it wouldn't be well, how about pass or fail? Can I get that out of you, Dr. Gogu?
Well, I think in certain aspects, I think they are passing, but I think in certain aspects they are failing. I think they've been doing a really good job with messaging. But I think in trying to get the resources to healthcare workers, I would not give them a passing grade for that.
Ooh, all right. I don't want to be in your class. All right. Well, with that being said, a 4th shot. You spoke about Israel, right? They're already rolling out a 4th shot to older adults and also healthcare workers. Are we on the way to that? Dr. Anthony Fauci actually answered a reporter's question about that, but he said we're a ways from deciding that right now. Do you think that is a direction we should take?
So I really think it should be in the matter of what are we trying to achieve here? Are we trying to achieve a complete prevention of COVID infections, or are we trying to minimize severe death and illness? Because if we're trying to minimize severe illness and death, then I think we have the right protocols right now in the 3-shot series. But if our ultimate goal is we want to eliminate all infection as much as possible, then you have to discuss the fourth shot. But right now, if you just look at America right now, we're having a hard time getting people vaccinated with the first and second dose and getting them boosted. So I think we really need to message that much more further.
All right, Dr. Sujan Gogu, it was a pleasure having you on BNC Live, sir. Happy New Year.
Happy New Year to you as well. Thank you.
Thank you. All right, Dr. Gogu stopping by. All right, experts weigh the potential economic impact of the pandemic, this highly transmissible Omicron variant. Well, exactly what we were just talking about. We'll talk about the economic impact it's having on the country